advocated increased participation in breast cancer awareness, regularly engaging in self and clinical examinations and early presentation to hospital to fight against breast cancer in society. Rafai Akin-Odanye reports that breast cancer is the second leading cause of cancer-related deaths, especially in women. Let's see that.
Consultant radiation oncologist says the aim of World Breast Cancer Month is to reduce the stigma associated with breast cancer, encourage early detection, promote research and treatment advancement, and improve the quality of life for those living with the disease.
But the best way to discover breast cancer, is by regular self-breast examination. By the time they discover breast cancer in a patient in the hospital, it might have gone far.
I had no cause to it. When I took to the doctor, they read it and I had no issues. But since then, I've always taken it upon myself to always self-examine.
I do it every month. And my mom too helps me too. Whenever I feel this solid lump in my breast, if I'm having my ovulation.
Breast Cancer Awareness Month, popularly called Pink October, people are expected to adopt pink color and display pink ribbon to raise awareness about breast health in Ibadan. Rafia Akin-Odanye, NTA News.
All right, we're still in the Awareness Month, and we have our correspondent waiting to give us more update on that issue. Very important. Rafai Akin-Odanye, please go ahead. Tell us what you know.
Thank you, Ruth. Breast Cancer Awareness Month is a global campaign dedicated to educating individuals about breast cancer and encouraging proactive measures for early detection. It is also aimed to empower women to take charge of their breast and provide a platform for advocacy. I have here with me a psychosocial assistance to patients and survivors to enable them with the after effects of the disease. Her name is Dr. Elizabeth Akin-Odanye from the University College Hospital, Ibadan. What is psychosocial support for breast cancer patients and survivors?
When patients are diagnosed with cancer, they often experience a wide range of challenges that could affect their mental health, their interpersonal relationship with others in terms of social relations. It could also affect their emotions and as well as their spirituality. So psychosocial support for cancer patients and their survivors, therefore, refers to all of those supports we give to patients to help them adjust adequately to the cancer diagnosis and the treatment. And this will start from effective distress screening, which we call the sixth vital sign, assessing for distress. Because when you do not assess for this distress, then there is actually it's difficult to pinpoint exactly what is wrong. It is not enough to just give them a blanket diagnosis and say every patient that has cancer or breast cancer must experience distress. But it's important to identify the specific distress so that they can be referred to these different specialists that can treat them for those things that are giving them concerns.
Thank you. How have the women taken advantage of this form of treatment?
Maybe where I want to actually start from is identifying the fact that we do not have enough support, psychosocial support for cancer patients in Nigeria. In the University College Hospital, Ibadan, we have a structure, the psycho-oncology unit at the radiation oncology department, where these patients can access care. But this type of unit ought to be replicated in other teaching hospitals or wherever cancer patients are being treated. This type of unit ought to be replicated so that patients can have access. In this hospital, in University College Hospital, Ibadan, we have the psycho-oncology units where breast cancer patients have what we call the breast cancer support groups, where they have their monthly meeting. And what that group does is help them assess support from the healthcare providers and from the patients themselves. We also provide individual counseling in order to give the patients a safe space to express their emotions, and we teach them how to problem solve. Because sometimes when patients experience breast cancer, they have a lot of challenges that they are not so sure about how to address. And one of the core problems that we also have is that of breast prosthesis from after mastectomy. What do I use? And so I personally call on the government to also assist in this regard in creating more psycho-oncology units in our different hospitals.
That is all from Ibadan. It is back to our Lagos studios.